Answering the call for help, medical teams from North China leaving for Wuhan and Hubei province, the epicentre of the outbreak of the novel coronavirus. None of them knowing what they will face when they get there, nor how long they will have to stay. And late this afternoon, the World Health Organization issued this warning.
The whole world needs to be on alert now. The whole world needs to take action and be ready for any cases that come, either from the original epicentre or from other epicentres that become established.
Wuhan and surrounding cities remain in virtual lockdown, villagers even barricading themselves against a virus that does not respect borders. And the WHO has also announced that tomorrow it will reconvene its committee to decide if this is a public health emergency of international concern that would trigger an international response. But the team who has just returned from China praised the country for its handling of this outbreak.
The fact that to date we have only seen 68 cases outside China and no deaths is due in no small part to the extraordinary steps the government has taken to prevent the export of cases. For that, China deserves our gratitude and respect. And they're doing that at the expense of their economy and other factors.
There is no end in sight, though. Confirmed cases are now just under 6,000, more than the number in China infected during the SARS outbreak in the early 2000s. The death toll has also risen to 132. And now airlifts of foreigners from Hubei province have begun. 4 passengers on the evacuation flight to Japan had coughs and fevers, and 2 were diagnosed with pneumonia, although it's not confirmed that they have coronavirus. Tomorrow, Britons who want to leave will be flown out, but wives or partners with Chinese passports will have to remain behind. And those who do return will be put into quarantine for 14 days, the incubation period for the virus.
We should be reassured that the NHS is well set up to deal with this sort of infectious disease. Public Health England have done lots of training, and the NHS executive have sent out information to all clinicians and GPs. So it's really up to the public to take some responsibility here as well.
The source of it is still unknown, though theories are it may be, like SARS, in bats and transmitted to humans via a wild animal sold at the Wuhan seafood market. A crackdown was earlier this week announced on the sale of these creatures, but that came too late to prevent this outbreak. And health experts continue to say the best protection is hand washing, staying at home if you feel unwell, and keeping away from those who are sick.
Victoria Macdonald reporting now. Joining us is Dr. Rosalind Ego, who works in public health epidemiology. And I'm wondering, are we any clearer about the cause of this outbreak?
Yeah, so we know that this is caused by a coronavirus, and coronaviruses are a family of viruses that infect people and animals all around the world. And there's really very, very new evidence now from the genetics of the virus that it's closely related to something that exists in bats, but we don't yet know how it came into humans. So whether it was from bats into people or from bats into an intermediate host and then into people. But what we do know, it's clear that this is a zoonotic spillover. So a virus that circulates in animals has spread into people, and now we have person-to-person transmission between people.
Now, you model public health epidemics. Some scientists have models that suggest maybe 100,000 cases will flow from this outbreak. What does that tell you?
So at the very beginning of outbreaks and epidemics, there's a lot of uncertainty, especially around key characteristics of the virus. So for example, from when somebody gets infected to when they start to become symptomatic, or when do they start to shed virus, these durations are very important. And that means these early estimates, there's a lot of uncertainty. There's a wide window of what we might expect to see. And as time goes on and we learn more, our confidence in our estimates will come down, and that will allow us to better understand what we expect to see.
Is it sensible to airlift people out of China?
So repatriating Britons is a perfectly fine policy. And the key thing is that even within Wuhan, this is an enormous city, there are a lot of cases, but on an individual level, it's still quite it's unlikely that the people will be infected. But as was mentioned, the people coming back are going to be closely looked after and monitored. So if they do show symptoms, or if they, then they'll get, medical assistance as quickly as possible. And there's very unlikely there'll be any transmission into the community.
Now, actually, we heard somebody at the WHO saying that there are only 68 cases in the whole of the rest of the world. Do we expect a spike?
So right now, as I mentioned, there's this incubation period, the time from when you get infected to when symptoms start to show. And we think this is on average 5 or 6 days, but in some people can be as long as 2 weeks, as was mentioned. And so some of the cases that we're seeing now that have been exported are from further back in transmission. They happened quite a few days ago, before some of these interventions happened in China. So right now we have to wait and see if these interventions that have been put in place in Wuhan and in other places have had an impact on the transmission.
The WHO committee is meeting tomorrow to decide whether to declare an international emergency. What do you think they'll do?
So this is a really critical point in the outbreak, a really critical time. And regardless of whether they declare a public health emergency of international concern tomorrow, what we need is increased collaboration, increased transparency, and that global health community working together is really what's going to stop this outbreak.
But if they do determine that it should be an international emergency, what does that mean?
It means then there'll be particular activities that happen in certain countries, and that'll really bring together the collaboration amongst countries.